Hi listeners, welcome to the Women in Sports Therapy podcast from the Sports Therapy Association. We are your hosts.
I'm Fiona.
And I'm Debs.
We're so excited to share this month's episode in which we meet with STA member Lesley Campbell from Lesley Campbell Massage to talk about work-life balance with women's health in mind.
Lesley has a sports and remedial therapy background working with soft tissue and a particular interest in anterior neck treatment.
And with over 2 decades of experience, she's worked with clients both in supported living settings and more recently in her own therapy space.
We can't wait to share our discussion with Lesley in this episode, which includes conversations about the influence of hormonal fluctuations on mental and physical health,
the use of technology and resources to work smarter, not harder,
advocating for oneself and others, including leading by example.
And we draw upon Lesley's experience of perimenopause in our discussions, as well as her signature treatment method, the Shoogle.
And of course, not forgetting her unanticipated beekeeping responsibilities and her love for her polytunnel of vegetables.
So without further ado, here is our chat with Lesley Campbell. Please enjoy. Hi listeners, we're here with Lesley Campbell of Lesley Campbell Massage. Now, Lesley is one of our STA members, and as you know, this episode we've invited a member on to talk about their experiences with work-life balance. So thank you, Lesley, for joining us.
Hiya.
Welcome. So just to give our listeners a bit of a background on Lesley. Lesley has been in therapy industry for over 20 years, starting out with Swedish massage, and we'll ask her a bit more about her work in a moment. But she has worked with people who have supported living needs and also set up her own treatment room about 6 or 7 years ago. Her pain she has an interest in pain and how touch can be manage stress, used to manage stress. And her speciality work or technique is the Shoogle, which I'm absolutely fascinated to know a little bit more about.
So excited.
Yeah, it sounds really interesting. And she has quite a few personal interests that sort of involve being outdoors, from what I can gather. So looking after bees and a polytunnel full of vegetables. So a gardening person, and also describes herself as an experiential person. So Lesley, thank you for joining us and welcome. Maybe you can just give us a little bit of a backstory about how you use your life experiences, work-life balance understanding, and your training to help your clients. And who do you work with as well in the clinic?
So I work with a real combination of people, from elderly right through to young people. So not so much younger, but so I work with a real combination of people in all different capacities. Some people just want to come because they want to totally zone out.
Yes.
And it's an important question that I always ask people at the start of each treatment. And it sounds a bit weird. And I say to them, I don't mean this in a hippie way, but what do you want the vibe to be today? Like, that's when I'm doing hands-on stuff.
That's great.
Because sometimes people want to feel a little bit more, this is going to sound a bit strange, people want to feel a little bit more in their body.
Yes, I understand that.
And so I kind of angle my treatments round and about that and how I work, but also I like to get people moving if that's what they need in their life, and sometimes you just need to get people to stop moving so much.
Yes
You get both. I don't know, did I answer your question there?
Yeah, you did.
Yeah, definitely.
I love rubbing people.
yeah So you're very responsive to their needs by asking questions and feeling your way through, aren't you?
I try to do that. I try to gauge. It's not always right, and it's taken me a long time, and that's where the personal experience, I suppose, comes into it. It's taken me a long time not to walk away and beat myself up when I don't think that I've given somebody the best treatment, or that I've given them the best treatment, but it's maybe not met their needs.
Yes, okay. But you ask lots of questions to do that, and you've got vast experience, haven't you?
Yeah, so I now know to walk away and not sit and ruminate for the rest of the night and let it go over and over and over and let it be the thing that keeps me awake at night, because that's what
Good. And obviously you have clients coming back to you time and time again, so you must be doing something right, I'm guessing.
Yeah. double-edged sword. I don't mind them coming back because if people want to come back to me, I'll say, as long as you know I'm not fixing anything. If you want to come back and chill out, great. If you want to come back because this is your I have like kind of like widowers who come to me, or people who need some cosseting. So when people, but I'll always say to people, like I used to say, no, you don't need to come back. And then I was like, well, wait a minute. I'm like, they want to come back.
Yes.
So like,
yeah.
Right, come back as long as you know that I'm not fixing anything. This is what we're doing. You're coming for the stress relief, you know, for the time out, for the time for yourself, for self-care, which then ties totally into all the hormones and everything. So I do have a lot of regulars,
So one of the things that when Fiona was saying your introduction, a little bit about what you do, your professional interest is in pain. You're saying about people coming to relax, but you do this anterior neck work, and you also do something called the Shoogle. Can you explain both of those to us?
So the anterior neck stuff came about because I did a course with Walt Fritz, who we've had on the STA.
Okay.
I've done a couple of courses with Walt. Just great. He's so great in how he just explains things, and he's had such a in life, going from his background to people in it, you probably know it because he's gone from the myofascial to how he explains things. Anyway,
wonderful.
I did a course with him in Dundee, and it was all about, and he's still touring with that course at the moment, vocal, and just interesting what people hear and
down the splenius. Yes.
Again, that this connects again to people breathing and menopause and perimenopause, they're breathing and they're up here, and this can be all tight. So I do love doing a lot of work around there. And the Shoogle does what it says in the tin. If you're Scottish, you'll get what it is. I just basically lift up people's limbs, and if they're not switching off, I try and confuse their nervous system so that they can't anticipate what I'm doing with their limb, all within pain-free range of motion. And I just literally lift up the limb and give it a bit of a Shoogle, and people love it all around the pelvic area, all around the glutes, let it all go.
For those who are listening rather than watching on a YouTube, Lesley gestured with her hands the Shoogle. it was quite literally a lifting action and a shake at the top.
So I put my hands around the ankle.
Yeah.
If I'm doing the legs bent. And then I just and I lift the thigh off the table, and I just really just give it a good old shake, and obviously make sure they're comfortable with it.
Even just seeing it makes me feel better. So I can only imagine the effect on the client.
I'm adopting the word Shoogle. I love it. I think it's wonderful. So thank you for explaining that. And then from a personal point of view, you've told us that you keep bees. You have a massive polytunnel full of veg, desperate to know what's in that polytunnel veg-wise. I love my veg. And that you love weight training, and that you love your garden. So you are such a hands-on person, and you really like to learn by doing things, by pushing things forward with your hands, feeling it. You were saying that off air, you were saying to us about the polytunnel was somewhere where you were the most happiest because you're just seeing stuff cultivating, you've got your hands on, you're feeling nature, things like that. I think for you, it comes across that that's where you're the most happiest, when you're doing things. So can you explain sort of a little bit about what's in your polytunnel and why you keep bees?
I never wanted bees.
Oh.
The bees were not a thing that I wanted. It was a really, really close friend of mine wanted bees, and where I work happens to have some land, and so I had a client who kept bees, and the two aligned, and now I've got a bee suit, and actually my car is full of thing at the moment with frames, and I've got and I get up to here, up to my armpits, and bees, and
oh my word,
I never wanted bees in the first place. How come?
Lesley, I feel like that is something a quote that should be put in a placard. I never wanted bees. I never wanted Lesley Campbell.
There's four of us that we have a bee mentor, and she keeps us right. And we do our best to try not to kill them and keep them happy.
Oh, I love this.
Polytunnel, I'm a very good digger. I love digging. So we've got lots of tomatoes and stuff, and that again, so taking it back to work-life balance, being in the garden and being outside is something that's very important for me to touch base and to take my stresses away and take my anxiety down a bit.
Yes.
Yes,
that's understandable too. Yes, definitely. So moving on to work-life balance, you have run your own clinic. Do you call it a clinic, or what do you call yours?
Just treatment room. Yeah.
Treatment room. Yeah. So you run your own treatment room, and you need to be outside as well because that's good for you. So how do you balance both? What is it that you think, right, now I need to do my time here? Do you structure that, or do you just say, right, I need a break, I'm going outside? How do you work it?
No, I'm really strict with myself now. And I did the old self-employed thing of my online diary was just open from 9 till 5. Or sometimes later, and so sometimes you'd have a client at 10, sometimes you'd have a client at 5 in the same day, and I went, no, right, hang on. And once I started to get a bit older, I thought, no, I can't function like that. And it literally has only been in about the last year or so that I've narrowed it right down, and now I take no more than 4 clients in a day, and I'm really strict with myself.
Great, that's really good.
I don't have any more than 4 because I would be worried, and that would trigger my anxiety that I'm not giving them the best.
Yes, and that's not what you're about at all, is it? You want to give every single person as much as you can give them.
And I know financially not everybody can do it, but I've maybe made some life choices. I drive a really old banger. My house is quite small.
Yes.
So these life choices allow me to go, actually, I'm not taking any more clients today because I have to talk the talk and walk the walk. There's no point in me telling my clients when they walk in the door, you need to look at your work-life balance, and then me to be running a bit like a headless chicken.
That's absolutely right. Yeah,
so true,
definitely.
yeah.
I need to be chilled, and I'm very fortunate where I work and where I live as well, because you can't see them, but I'm in the middle of the Campsie Hills.
Oh wow.
When I walk out of my treatment room, I've got the hills and everything around me, so I'm very lucky.
So you can breathe as soon as you walk out your door, basically, can't you? Very much so. Okay, I've got that. Okay, so we've asked you some questions over an email so that we can get sort of a good sort of picture, I guess, about work-life balance and what affects that. So you've really kindly said to us about how your personal life and your treatment room is already a balance that's going on. So I'm going to throw another little curveball in there, and we're going to ask you questions about hormones now. So hormones literally determine who we are and how we act. So have you noticed any ways that hormones influence your personality now, and how has this affected you?
Yeah. Hugely.
Uh-oh.
There's physically the hormones influence you. So if I talk briefly about the physical bit, I use the Fit Our Women app, which
What's this?
Fit Our Women, so FITR Women app.
Okay.
And basically I record because I still have a cycle, so I'm perimenopausal, I'm not menopausal, so I still have a cycle. And you when you use this app, the Fitter Women app, you're and there's other apps out there.
Yes.
I put in when my period is, and then I know where I am phasally.
Yeah, that's really helpful.
And that's really good for you. I tell people about that all the time. Younger women, people that are in sport, I tell them about that app all the time. And so physically, I can go to the gym. Now I love weights, like you mentioned that. I can go to the gym, and I'm like, I'm just not feeling it.
Yes.
And my breathing goes funny, and I'm trying to do like a deadlift, or I'm doing a whatever, and I'm going, I just can't. And then sometimes I'll just go, where am I? Where's my cycle? Hang on.
Yes.
What's happening here?
Yes.
So physically, the hormones fit absolutely. Every person on here that has up and down with hormones will know exactly what I'm talking about. There's just times where you just don't feel like Superwoman.
And what gives you that confidence is following an app. I use something called Period Tracker, so it's very similar. And what gives you that? Why am I being such a emotional wreck today? You look at your app and then you go, Oh, right. Okay. And that actually calms you down, or I feel that it calms me down. And you're getting that sort of sense as well. I'm sure our listeners will probably, if they track it or if they don't, it really helps to manage your life a little better, I think.
Absolutely.
Yeah.
Absolutely.
Okay. And what about your personality traits? Because often when we go into our treatment rooms, it's all jazz hands and smiles, isn't it? So how do you cope with that situation where you're feeling, you look at your tracker and you go, I'm having a rough day. How am I gonna? So what do you do to get through with your clients?
To get with pacing, making sure that I'm feeling okay. Most definitely, one of the things that I do is think about, I may feel like Superwoman this week, but I might not next week.
Yeah.
So, I said about sticking to those 4 clients.
Absolutely.
I will sometimes take a client if they have a circumstance that they need to come out of my hours, and then what I'll do is block out another hour and go, okay, you can have this hour, but I'm taking out that hour. But when it comes to the actual hands-on stuff,
Yes.
Well, yeah, there's a few things that I do.
Okay.
Do you want me to talk about what I do practically with that?
Yeah.
That's really helpful, yes.
So practically what I do, if I am feeling hormonal, I will do things like make sure the client's warm, but the room's not so warm.
Great plan.
So I use like an infrared heat lamp on them when I expose any bits of their body. They're on a heated mat and a heated
Yeah.
I can breathe because the room's not stifling.
Yes. Yes.
So I do things like that.
Yes.
And in terms of how that impacts on you, Lesley, is that because your temperature might not be managed so like easily? Your own personal temperature, is that linked to any other hormonal kind of issues or like fluctuations? Or
the funny thing is with me, it's if I get an anxious thought.
Mm-hmm.
And if I get an anxious thought when I'm massaging, which can happen,
yeah.
If I get an anxious thought when I'm in treatment, that's when, and I think, well, they did functional MRIs on that, and it's like it's from here up. So I get what's called a flash.
Yes.
Mm-hmm.
And if I know if the room temperature is okay and I'm feeling okay, I can bring myself back down out of that flash pretty quickly, and I'm okay. But if the room's really warm, then I find that harder to control. But that's hormone driven, absolutely, with the anxiety, and then sends your temperature away.
It's almost like when you are embarrassed and you get that that sort of feeling of your face goes red, and you that it's almost that feeling, when you're shy, if you're very shy and your face goes red and you feel embarrassed and you feel hot. If you get an anxious thought, and that's the sort of feeling. So for younger listeners to sort of experience, or for male, that's kind of that embarrassed feeling that you kind of get in the face is, I think, what we're feeling. Yeah,
are we describing a hot flash?
Yeah, those flashes. Yeah,
maybe perimenopause kind of stages and things like that. Yeah, because I don't know if we actually like really touched on this subject yet, but I suppose it's something, in terms of like our ages respectively in this chat, kind of my age category is sort of mid-30s right now, so I'm not really experiencing any kind of, like, that I'm aware of anyway, symptoms of perimenopause or menopause, and it may not be true for you guys. I don't know how much you want to share, but like that kind of symptom is something that I don't really readily think about on a day-to-day basis as being a reflection of my hormonal state. So I definitely flush when I'm embarrassed. You can read me like a book if I'm embarrassed.
You can feel that too, Fiona. You know what that feels like.
I can relate to that, but certainly I've never experienced in a clinic setting or thought about accommodating a temperature change to separate a client from me in terms of the exposure of temperature. That's fascinating. That's a really nice workaround.
Yeah, so that's a really good point on you, Lesley. I also have a heat pad, and like I open a window. I work from a cabin with us here, and I'm like you. I think I'm going to have a day I'm going to be too hot. So I make sure I'm wearing shorts. I make sure that I've got loose clothing on. I often wear my STA top anyway, because I advocate for STA. And I'll open a window, and then there's a heat pad. And some of my ladies also get quite warm, that are hormonal, and they will say, have you turned that off? I don't want it on, you know. And then some of my ladies are now on HRT, and they're like, put the mat on because I'm freezing. So you just work with that person. So I think, yeah, I'm with you. I totally understand that. And it's difficult to then, as we get older, as females, as women, to try and incorporate how we're going to continue our professional career with a work-life balance, bearing in mind that things are changing within us. So I think, Lesley, that's a really lovely way that you've put that across, and how you manage that life balance, you know, what's going on with you within your body, and yet you're still servicing your clients. I think that's amazing.
And it is a real thing, so that you're not feeling strung out, you know, like, and knowing that I've got a gap between clients, not a huge gap, but a bit of a gap between clients. Fueling, make sure a lot of these are dead basic stuff that people, male and female therapists, have to do. Do you know what I mean? And fueling, hydration, all of that sort of stuff, making sure that I'm, you know, feeling. And I think, I don't know about you guys, but there's a kind of a hat that I put on.
Yes.
So when I walk into my treatment room, I put that hat on. And the response that somebody gets from me in the treatment room, like a lot of my friends would probably say, I'm very different in my treatment room than I am outside. If somebody asks me in the pub about a sore ankle, they're probably going to get told to stop moaning and go on with it. Like, do you know what I mean? And I'm like, you know, nah, do you know, just a bit of resilience. Go out and you go, you'll be fine. Yes, calm shit down, build shit up. Yeah, you'll be fine. So there's a kind of hat that I put on, and I think that's kind of my cloak when the hormones, because you don't start thinking about, you're out of you and you're thinking about them.
Yeah.
So I think that definitely helps with the hormones, and then you come home and just probably let rip to the other half. And
yeah, that happens.
Wow. There's definitely something that I think is predisposed in therapy practitioners, is that we have this sort of ability to empathize. If you don't, you're not going to probably have a very long and healthy career in that field. And in terms of, you know, dealing with our own needs, they often get pushed down the list of priorities. And once you have a fully booked clinic, you know, or somebody says, can I come in on a day, it's very hard when you think in terms of prioritizing, like, oh, well, this person's needs are far more important than mine. This person is reliant on me and, you know, is struggling with a pain or an issue. Is there a way that, like, it sounds like you've had a few boundaries kind of put in place and, you know, set a schedule? Because I think that's a thing that a lot of people do, especially very early on in setting up a clinic space or a therapy room, to open up the calendar and just say every day is business hours, all day, every day, anytime. Like, even like, oh, you can't come in, no. I'll come to you. Like, no. Yeah. And these boundaries, and I think it takes time, and that's why maybe a slightly more experienced therapist will have these things in place, and earlier in a career we maybe don't. Did it take a while for you to kind of set those? Because you said, I think you've been in industry for 20 years or more. So whenabouts did you set these boundaries, Lesley?
Yeah, I was mobile for a long time. And then when I went into the clinic, like I was saying earlier on, when I went into the clinic, I was just open all the time, you know, like I'll fit round you sort of a thing. And yeah, it is an age thing. You do get more comfortable with it, and you still have the panic moments when you've got a week that's quieter and you go, that's it, my business, that's it, right, it's going, like I'm
yes,
SHIT at my job, nobody wants to come and see me.
Yes.
Like, so, but then you begin to calm down with that and think, no, actually, I don't need to work a weekend. You know, and people go, why
Agreed.
don't you work the weekend? And I go, because I don't have to. I don't have to work the weekend. And I've even just changed my hours as well, with another clinic that I work in, so that I'm not working another evening.
Yeah. And
so I've just, you know, I've just shifted that as well. So yeah, you do, age and time and experience definitely makes you go, nah, do you know what? Nah. These are hours.
And what you're saying to us, Lesley, is that you periodically look at that again. You think, right, where am I at right now? And then you revisit that, and that's great. And I'm wondering how many of our listeners sort of take stock and, you know, don't get caught up in the rat race and then come back and revisit and go, right, where am I at right now? Okay, I need to change my hours there. I need to, and that's a really good tip, I think, for work-life balance on this, is stop. Where are we at? Where do I need to change things? How am I feeling? Do we ever ask ourselves? And I think, wow, Lesley, you do that. You ask yourself, how am I doing right now? I'm not quite sure. Yeah. And that is a really good personality trait of yours that you've either developed, I'm not sure, or whether that's been taught to you, or I'm not quite sure. Is that something you've developed?
No, I've probably developed it. Yeah.
Wow.
Developed it as I've got older, and probably as you get more, you know, a bit older and obviously a bit more hormonal, and you think about, okay, how am I going to not go mad while I'm dealing with this? You know,
absolutely.
It's needs must, isn't it? Really, you kind of out of necessity put boundaries and things in place. I can see actually on our list of questions, I'm going to skip ahead a couple because I think it's kind of tying in quite nicely. So as we've kind of been talking about, fitting things around day-to-day life, you know, you kind of have to prioritize. So are there any strategies that specifically you might have put in place that kind of help reduce, I don't know if you've heard of this term, decision fatigue, where you put in a position where you have to make decisions on the spot quite a bit, and it can get pretty exhausting, and with a self-employed situation in particular, where you're the only one that can make decisions. So we've talked about time management, but is there anything that you have experienced or put in place that makes decision making a bit easier when somebody asks you, you know, can you fit me in here? Or like,
I think having the online booking system works for that. And knowing, you know, so you're putting a kind of a boundary in place there that, you know, you can sort of refer people to having the online booking system. So I think that helps, because it saves the whole phone calls and the kind of emotional response you get to somebody when they phone and go, oh, my back's really, you know that, oh, my back's really, really killing me. It's been really, really killing me for months. Can you see me today?
Yeah.
And you're like, why? Whoa. And I'm really sorry if anybody that's listening to this that has done that. But, you know, what? You've had it for months. What does it need to be now? So having the online booking system is really good, because you can say to people, like, there's my availability, have a wee look and see what suits. And sometimes I say, there's nothing suit, just have, you know, maybe get back to me. So do that. We talked before about, if I take somebody out of hours, then I'll block off an extra time. I make sure that for decision making, I make sure that if I'm feeling like Superwoman this week, and I spoke about that I'm not projecting that onto that's how I'm going to feel next week.
Yeah, definitely.
Again, that's a good thing with the app. You can kind of look at it and go, see when it comes to next week, am I going to feel like that? And also it ties in with sleep, which we can talk about as well, because that's obviously a hormone thing as well.
Yeah, like that actually, you know, you just triggered something kind of like in my thought process really about that app and like tracking a cycle. So like we've previously in other WIST episodes have talked about the importance of tracking symptoms. And not maybe even just for hormonal fluctuations. I mean, it can be useful in injury management and all sorts of things, you know, migraines and whatever.
Yeah, performance management as well.
Absolutely, yeah. And I think a lot of people, perhaps once, you know, you've collected that information, how do you use it? Well, I think as you get into perimenopause anyway, and menopausal kind of patterns, you're not going to have those markers maybe as reliably. So tracking it, there may not be a pattern. It may be really hard to use that information to predict, okay, well, next week I'm going to ovulate and I'm going to feel like I need to like jump out of a window.
What was that, Lesley? Sorry, say that again.
So how
what was
how
that?
do you do
what did
that?
you say, Lesley? Sorry, what did you say?
Fiona said when she goes into ovulation and she says, I feel like, and I was going, horny.
Oh yeah.
Literally, it is incredible the amount of like difference in symptoms that you feel throughout your cycle. And I mean, like it can be really difficult. It can be really difficult to manage those symptoms, let alone like if you're perimenopausal and you're trying to like just deal with all that comes with that, and then you've got the unpredictable nature.
Well, our Matt with the STA, he's run a whole sleep episode, hasn't he, on the podcasts as well. So Lesley, you're absolutely picking up on something there for sure when it comes to the sleep situation and the hormone structure around that. And I think just a quick flip back to the online system that you use. Can we share with the listeners what one you use?
Use SIF Health.
What's it called?
SIF Health. SIF.health, SIF Health, that's the one that I personally use. There's loads of different ones.
SIF. When they set up SIF, so if our listeners aren't members of the STA, don't know SIF, the organisation was set up by some fantastic people, Malcolm and Mike, like they ran that for quite a while. They've changed hands now, haven't they? So, but yeah, SIF Health, and I think there are some other. I use it used to be called Fresher. It's now.
I've heard of Fresher. Yeah.
Is it still called Fresher?
I've heard of Fresher.
It was called Schedule. That's it, and it's now Fresher. And they promote the services as well, don't they? So they've got like a platform that makes you find, like, you can be searched for, and you have your own little page. And yeah, it's fantastic to have resources.
I think
like
Fresher
that.
is free. Well, sorry, Lesley.
I was just going to say that in itself was an anxiety driver for me going online. Because I'm a bit older, I didn't have technology when I was at school. And so, but I had to, so then what I did was, and this is talking about the decision stuff. Yes. I realised I had to take some time out of clinic. Yes. And go, right, I need to get my head around this. Yes. When I was setting up SIF, I've had an online booking system for quite a while, but I changed to SIF during lockdown. And Tom Marshall was absolutely amazing. He would sit and Zoom with me. And I mean, honestly, he must have felt like he was holding this old woman's hand. I was like, oh my God, I don't know what I'm doing, Tom. And he would just take over my screen and I'd be like, just do that.
I hear you. I have IT pain, like, no, it's just not my bag. I hear you.
But once I decided, come on, Lesley. And I am on HRT now, by the way. So I'm in a place now. And I go, right, come on, you can do this. You're going to sit down. You're going to take some time out of clinic. You're not going to make this extra. You're going to have, you're going to take this hour or 2 hours and you're going to sit and focus on this issue that you've got. Yes. Doing the tax stuff. My husband goes nuts. That you sit and you do those things that are really, for me, the rubbishest parts of the job.
Yes.
Yeah. Give me a paper and I'll rub them all day.
I hear you. Totally hear you. Yeah. Found will tell you that IT is not my strongest.
Yeah,
everybody in the STA knows that.
We've found a workaround. This is where it kind of gets complicated, though, doesn't it? Because Debs and I are quite lucky that we work as a team on this podcast. Yes. But then, in an actual clinic setting where you're self-employed, you're the only you're the only one. So
your responsibility, isn't it?
And income, you don't make buckets of money as a self-employed therapy practitioner, and it's anybody out there who's a therapy client may not be aware of this, but it's not a lucrative industry unless you've got multiple revenue income sources. Like it's just a very difficult industry to work in. It's quite unpredictable. So the people who work as therapy practitioners really love what they do. Like, we really love what we do.
Yeah, agreed.
And so you do have to do the work that you don't necessarily enjoy in order to get the work that you really love. But in terms of strategy, and that, like, that right there that you've just described, Lesley, is I personally am a big fan of it, is using those downtime hours to get those things done. And sometimes you put them off and it all comes at once, but that's probably the nature. I mean, I think of it myself as a bit of a procrastinating kind of individual, and I will put something off that I don't want to do until the last minute. I really thrive under pressure. just kind of create pressure probably inadvertently to
Yeah,
just
that's
get
not
stuff
me.
done.
No.
I've over the years I've developed skills a bit, you know, as you've described, Lesley, you kind of work out ways of doing things to get around it and better
Yes.
you know, work towards things. But in terms of getting like a tax return done, or a self-assessment rather, or you know, learning skills, you just have to kind of find a way of however might motivate you, because in the long run, learning how to do these things can be just so critical to the survival of a business. Like being able to have an online booking system is remarkably helpful. Like I remember when I took mine online and discovered, you know, Fresher, or Schedule as it was, and then SIF, and yeah, like it's a game changer. You know, faffy things like bank transfers and PayPal and none of that. You just literally, they do everything online, and yeah, it blocks out the time for you.
Can I just go back to something else? It was something that you said
Of course.
before, and this is changing from scheduling, but it was something that you said about women of all ages and our fluctuations.
Yes.
And I remember having a conversation with my husband, and I'm very open with him. We talk about where I'm at, and so that
Fantastic. That helps him.
Us to get through it together.
Yes.
And he turned around and said to me, because we were on holiday and I was having a period while we were on holiday, and he said, it's kind of like the worst of both worlds, isn't it? You're still, you're still having a period, but you're menopausal at the same time. So it's like you go into phase 4, and if nobody knows what phase 4 is just before you're about to bleed, and into the first few days of bleeding, I think is still phase 4. Correct me if I'm wrong.
That's right.
Your estrogen's down in your boots, and you're like that's when your sleep's getting disturbed, you're getting hotter, you're getting all of that stuff. That's when you really want to just tell the gym instructor to.
You have this anger that you cannot rationalize. Yes.
Squats today, you know, you have all of that going on.
Yes.
And then it's like it's on speed, because not only have you got your lowering estrogen, you've got your even lower estrogen because your hormones, and so that's when I made the decision to go on to HRT as well, and to be. And interestingly enough, I don't know if you've heard of Diane Danzebrink.
No.
So Diane Danzebrink is a lovely woman, and she's a therapist, and I think I can't remember her background, but anyway, Diane's had her own personal experience with medical menopause. So basically she's very open about it. She talks about it all the time. And there was something that she said recently in a podcast that I was listening to her talking in, and she said when she first went on HRT, she had a really good GP, and she was going backwards and forwards. And the GP said to her, do you feel like Tigger yet on your HRT? And she went, no. And, well, we need to play with your HRT. And I think that can be, I've kind of gone off track with talking about work, and I'm now talking about HRT and menopause.
That's okay.
And that's something that I think a mistake that some people make when they go on to HRT. It's not making any difference. It's not making any, well, you need to play with it. You know, it's not like you just play with your life. And I definitely, although I still have my moments, and I have my hormonal moments, we're all going to always have them.
Of course.
I'm definitely back to being Tigger again. I'm definitely back to I've taken on, you know, kind of like bigger work challenges that I'm like, no, I'm going to do that. I can definitely do that. Don't get me wrong. It can raise my anxiety and everything, but my sleep's much better since I'm back on HRT. You know, all of that. So definitely I'm an advocate for HRT. Why did I start telling you about that? No idea. We were talking about scheduling.
Yep. And also because I think from a work-life balance, it's such an impact. So you're sharing with us and the listeners that the change of a woman's body is going to impact the scheduling. So you could then go online scheduling traced around your tracker to then change those hours if you needed to. Whilst you went through the transition of HRT, you could change that so that you then lessened the impact, I guess.
And you don't have to explain to people like it's just like, I'm just not available, those are my hours there, like. And I think that part of that problem with having those conversations over the phone, well, I would never take a new client on without having spoken to them. An old client who's coming in and booking a session, you know, I mean, they know certain things about you, you know, you get into conversation, but how much you actually want to disclose of your personal situation, it's easier just to kind of not, it's hard enough explaining to, you know, those closest to us sometimes, you know, when you're in those really, like, unfortunately very difficult moments of, like, you know, hormonal changes, like whether that's for fluctuations just, you know, from pre-menopausal or perimenopausal. It's really difficult. I mean, I get really, I think I hold out really well at work. My colleagues might have, you know, I may have burst into tears a couple of times at work, but, like, you know, people are very understanding. But, you know, you kind of just try to manage through those work situations much more than you do perhaps are able to at home. I think when you're with people that you know, it's a lot easier to kind of, for them to feel the brunt of that. You know, I can be quite withdrawn, I guess, like when I'm, you know, really feeling like in the middle of, actually it's in ovulation, to be honest with you, like I just cannot articulate words very easily, like I just can't find words very easily, which may surprise you as this is a podcast. But yeah, I think just having an excuse to not talk to people, sometimes that's ideal, just to be with yourself.
I think talking about that as well, and talking about not finding words, and this is slightly different from what you're saying, but the brain fog
yeah.
menopause. And I, again, because of my personality, I'm kind of open anyway, and that's something that I do. I remember having one client on the table, and I was pointing at their quad. Couldn't remember the name of the, I was like, see that bit there, see that bit there, and I went, I do know what that bit's called, and then I just make a joke of it, and I go, I do know what that bit's called, right? Okay, I'm it. Right at this moment in time, I mean, quad. I couldn't remember the word quad.
Yeah.
And I think when you're open like that, and you were talking about how you deal with it in a work scenario, and I was talking about keeping them warm and me cool, and that's the other thing I do, is I'll be halfway through listening to somebody's story, and I go, whoa.
Yeah, where were the last 5 minutes? Yeah.
And actually, I've done a motivational interviewing course, and that can be a fabulous, I mean, it's a brilliant tool, and I would tell everybody to go and do a motivational interviewing with Gary Mendoza, who was also in the STA. He was brilliant.
Yeah.
Wow.
And that can be really helpful, because then you'll do the reflective listening thing and I'll go, right, just let me double check. And actually what I'm going is,
did I hear everything?
Yeah.
Just double check. So I just want to reflect back to you what I think, what you've said, and that's a great cover up. See if you're having a brain fog moment, you know, and you can do motivational interviewing, which is a brilliant tool anyway, to make sure and bring yourself back and kind of go, whoa, I'm there, and don't panic. See, when you get the brain fog and it comes down, you don't know where you are, just don't panic. It'll be okay. It'll pass.
People are a lot more understanding than you expect, actually. I think that because there's just been this culture of not really talking about hormones kind of affecting us, we sort of assume that opening up and having a conversation to say, look, this is just not working right now, I need to, like, take a break, or I need to repeat something or whatever. Everybody wants more efficiency and, like, for everybody to feel okay. So it's very unlikely that you're going to get a client in front of you, you'd hope, a client that you'd want to work with at least, that would say, well, you know, I don't feel like any empathy for you switching off while I'm talking. Like, I've never done that. How likely is it that you're ever going to get a client that's never zoned out during a conversation and not understand?
It's not even a switching off, because you're there, you're really listening, and then
it's just gone.
And then you go think about what they said, and it's just not there.
Wow. It doesn't come back. It's like instant recollection is just gone. It cannot. Yeah, it just doesn't come back. You've heard it, but it's not coming back to you. I had a very similar situation with a towel. I said, can I just move this thing on top of you? Towel, Deb. Yes, towel.
Wow.
Yes, thank you. Yeah.
I've got so much to look forward to.
Sorry, Lesley, you were going to speak then, and I just talked right over you. Please continue.
Oh, I pulled it back again because my HRT is really working today, by the way. It can happen when I'm mid sentence, and that quite often will happen. I do talk quite a lot as well, so but I'll be mid-set, lose my track entirely, you know. Like,
where was I going with that? I can't remember.
Times already on this chat where I'm like mid-flow, and then I go, no idea what it was you asked me, no idea why I'm telling you what I'm telling you.
Absolutely fine. I think there's a lot of information that you're giving us and the listeners that is absolutely valuable. I just want to go back to the HRT situation. There's some women that won't be able to take HRT. I'm going to be one of them because of endometriosis. And so I don't know if you know very much, or whether the listeners know very much about what happens if you can't take the HRT. Does that mean that I have to just suffer, you know? And I think some of the aspects that you've said, Lesley, is really important. So even if HRT isn't something you can take, you can still put in work-life balance things. For example, the online situation, do some research, dietary things as well. So go and see your nutritionist. Absolutely key. If you can't do HRT, go and see a really good nutritionist who will give you dietary supplements and dietary advices to try and stabilize some of the estrogen levels, etc., which may work. So I think there's a lot of menopausal talk, perimenopausal talk, where people are saying, oh, I'm fine now, I'm on an HRT. That, like you said, Lesley, there's this structure of we have to play with it because it's not quite enough estrogen. It needs to drop a bit. There's too much testosterone still coming through. And the way that it's working is quite not right. However, for women that can't take it, some of the key factors you've said today is anxiety is a big thing with menopause or perimenopause, and a lot of women feel incredibly anxious. They don't feel like themselves. They don't know what's going on. But there are other routes, and I just wanted to kind of pick that up for listeners as well. That it's not, you know, HRT is magic. It's incredible, but some women won't be able to take it. Totally understand that. But there are some other routes, and my first port of call would be see a nutritionist. It's worth it because you're going to then try and manage it with diet and supplements, which can also be huge. But then also, Lesley, some of the stuff you've said about making sure that your life work balance to then accommodate you and how you're feeling, use the tracker, use an online system. These, even if you can't get the HRT, these are absolute key plans to kind of get you from where you need to be. I'm going to let you ask some more questions, Fiona. Sorry, I just needed to kind of put that in.
Just adding on to what you're saying there. Don't lose hope, because I'm sure I remember them saying that they are going to try and develop an HRT for people that have estrogen issues, and they're going to try and bring it. I don't know how far down the line that is, but I remember them talking about that a few months ago. And also, for anybody listening or watching that has any other issues, as in vaginally, because obviously things change down there. With menopause, you can use localized estrogen still vaginally, and also don't rule out, you touched on testosterone there, your testosterone drivers, your testosterone goes down as well. So there is now a big push for people to be adding testosterone into their blend of what they're on for HRT as well. And I don't know if that's suitable for endometriosis, but there's definitely other things that you can, other avenues that you can look at as well for other.
Such a big area, like such a huge subject with so many options. I think that part of, you know, current discussions that are going on in the media are fantastic opportunities for these new kind of approaches to dealing with the symptoms, because you can't stop. Ultimately, the menopause is something that will happen to every single woman, or person with female reproductive system. So unless, you know, we're talking hundreds of years from now, and maybe, I don't know, for some reason it's possible to carry on ovulating forever. But yeah, I think that it's definitely a subject that we're going to have to break into in another episode and deep dive into, you know, more into HRT and, you know, other symptoms that kind of come along that people perhaps don't talk about because they're maybe a bit more sensitive, or, you know, I mean, hormones are one thing to talk about, but changes to, you know, your reproductive tissues, and it's a very sensitive subject. That is in its own right probably an entire series of WIST episodes.
What I'm loving though, Lesley, sorry to interrupt you there, Fiona, what I'm loving about you, Lesley, is that actually what you recognised was the issues of how you were feeling before you even took the HRT. So you recognised that I needed to pull back, I needed to look at what's going on, put myself onto an online system, check out the tracker. And it's not until all of that you kind of had in place before you really took the HRT, is what you've said in the chat. And I just think actually that standalone is brilliant advice, and really good way of managing life and work.
A lot of it's
we're here to live. It's not all about.
I was going to say, a lot of it seems like it is just trial and error as well. You know, you try something and it works or it doesn't, and you just keep layering it up until you find the mix that works, you know, for the time that you're in.
It's a funny thing as well, though, because by the time you get to my age, I've heard people describing us as the jam sandwich sort of, you know, you've got maybe younger people that you're responsible for, and then you've maybe still got older people that you're responsible for, and you start to put down all your changes, your anxieties, you're stressing, you're not breathing so well, you're not sleeping so well, all of that sort of stuff, you start to put down to, well, it's a stressful situation, it's all my stresses. And I was with me, I was going lockdown and all that sort of stuff. So I've been on HRT for about a year.
Okay.
A yearish. And you start to come up with all of these different things. And I had a one-to-one Zoom consultation with Diane Danzebrink, and she was great, and she went through this 30-point thing, tick sheet thing.
Yes.
And asked me these, what do you suffer from?
Yes.
By the time we'd finished talking about that and we had summarized it like that, I was like, oh, right. Oh, okay. And then she said, you know, you're doing all these things, talking about the online booking, looking after your lifestyle, She said, just try it. You don't, because there's another myth, and again, sorry, this is going on about HRT more than work-life balance, but again,
it's important, Lesley, really is.
There's another myth that when you go on HRT, you can't really stop it or anything like that. And Diane was just like, no, just go on it. And she was so like, she's so London. She's like, oh, lovey, just go on it. And, you know, and if you don't like it and it doesn't work for you and it's not worked, then just come back off it again. Your hair's not going to turn green, you know, and
fantastic.
You're already, yeah, when you think about it, you're already withdrawing from like certain hormones anyway. It's just it would be another withdrawal of hormones, wouldn't it, to come off HRT, surely?
You would just do it, yeah. But fortunately for me, I've just dabbled about with the prescription, and I've got to a point where I feel happy, and I don't feel the need to take any testosterone. But that's obviously a new one. But yeah, no, that was great, and having it, and that. Again, if anybody's listening who wants to check themselves, you'll have heard of the Balance app by Dr.
Yes.
Newton.
Yes.
And the Balance app, so I put a shout out onto my Facebook page, or I don't know, I was talking about hormones or something, and I got a really big response from friends private messaging me saying, and chatting, going out walking with friends going, I think you know, what do you think? And then me going, get the Balance app, check the tick sheet, see what you think. Because a lot of women can get to the point where they can't advocate for themselves.
Right. What can you tell our listeners what the Balance app is? Because for me, that's something that I've not heard of. Is this linked to identifying symptoms relating to perimenopause or menopause?
So the Balance app, it works a bit like one of your period trackers, and you put in your symptoms and what you're experiencing, and it will collate a health report, and you can go through the tick sheet and see how you are. And if you are the sort of person that goes to the GP and can't verbalise what it is that you want from the GP, or if they try to offer you them things you give you your antidepressants. If they try and offer you antidepressants or whatever, and you know that actually you've got a hormonal imbalance, you don't have depression, you can go with the sheet. So basically, just of a day, I'll maybe go, oh, I've been farting a lot today. That's menopause, by the way. Or vaginal dryness, or palpitations, heart palpitations, or not sleeping so well, and you can put your in it, seeing it all together like that sort of makes you go, okay, that's just my hormones changing, that's just what that is. And so you can get this print out and you can go to the GP, and I've said that to quite a few folk, and they've been successful in going to the GP.
Fantastic. I mean, that sounds like a tool not just for somebody going through perimenopause or suspecting that they might be going through the start of perimenopause or menopause, but for any therapy practitioners or exercise professionals listening to this podcast, or anyone else for that matter, wanting to advise somebody that's clearly struggling with things and not finding the answers, and may be in that window of time that could be linked to this change in hormones.
Yep.
We'll put all the links, by the way, if you're listening, we'll put all the links to these fantastic tools that you've mentioned, Lesley, in the show notes at the bottom, so that people can find these resources, because they will be incredibly useful.
And they also, talking about it from a therapist perspective, they also put, so they have like articles, and all different articles of the month and journals. And so as a therapist, if somebody comes to you and says, oh, I've got this or that, or whatever, you can have a week, and we press on the button, heart palpitations. If somebody's coming to you with heart palpitations, you can have a read up about it. Is that going to be linked to, if the ducks are all in a row and you're thinking, oh, this might be their hormones. And then, and as you say, you can guide them towards the balance app, but also you can have a wee read yourself as a male or female, or however you identify, therapist. You can have a look at that and go, oh, right, okay. So, but it's a really easy way, especially for for blokes maybe that have got somebody coming in. It's a good way for them as therapists to point to something without it feeling a bit totes awkward.
Yeah, because they're not subjects that we really, like we said, especially some of the more sensitive kind of intimate kind of issues that come up, being able to just flag those and talk about them can be, where do you start? How do you ask somebody about that? It's a great way around that.
And also, Fiona, sorry to interrupt you. So also, like you said at the beginning of the podcast, we are signposting people as a therapist. So it's really key. The NHS is overwhelmed, as we know. They get, people will get a 6-minute slot or a telephone appointment. If you've done, which seems to be all the work, but actually I think, Lesley, what you're saying is it's really empowering. I know me, I'm this age, these are my symptoms, I'm tracking it. The GP is so grateful for that information. You go, like, this is where I'm at, I've tracked it for 3 months, this is where I'm at, I believe it might be this. You're then saying, I believe it's this. The GP says, well, you've done all the homework. I think you're probably right. I did that very similar thing. I said, right, I've done this. And she said, I don't really know why you're in front of me. I think you need to up this, up that, and then we're done. And I'm like, okay, fine. I can't prescribe myself what I need. So, I needed to come to you. I don't know if I'm doing it right. I've never walked this before. But this is what I've done so far. So I think, Lesley, saying about the balance app is fantastic, because it just gives the person empowerment, it gives the GP the knowledge, and it gets you to the end destination much quicker, so it gives you back your life. So I think it's a great thing that you've mentioned. Thank you.
Yeah, and it does tie into sort of one of the themes of what I think we'd like to kind of talk about, as we sort of reach the final kind of section of our podcast, just to talk about advocating for ourselves and others. So this, we're talking a lot about hormones and things that relate to women, but this also is a subject that we really need everybody to be involved in an act of kind of like advocating for other people as well as ourselves.
Yeah.
Tracking our symptoms as, you know, people with female reproductive systems at various stages in life is something that we can do for ourselves to advocate for ourselves, because I mean, all symptoms including brain fog, you get into a GP clinic or room or on a call with a GP, if you don't have the information written down in front of you, it might not be there for you to, you might not have the, you know, ability to advocate for yourself and say what it is that you need from them, making that decision to ask for it. But any kind of like action could be, you know, included in advocating for yourself or another person. Is there anything that you have experienced, Lesley, where you've either advocated for yourself or others, or you've seen other people advocating for other people as patients or clients or
I haven't. I have encouraged people in the background, and I've even rehearsed conversations with people going into the GP, and sort of saying, if they say this, say that. The big one being, I think you've got depression. No, actually, I've actually got a hormone deficiency. Is what's going on. You know, so I have talked people through it, and I've not gone into the GP and advocated for them. But also with the Balance app and Louise Newson and Diane Dansbrink, they have written up letters, because one of the other problems that happens when you go to the GP is they can knock you back, which can be really, really difficult for women when you're in that situation. And they have letters that you can print off to give to your GP.
Yeah,
that's incredible.
That's where's that? Sorry, on the app.
Well, that's on the Balance app or in the Balance website. I think that's where they've got that. Awesome. Because I had a consultation with Diane, she would have been able to have written me a letter to my GP had I, you know, but I was able to. I was a bit ballsy. I just phoned my GP and said, this is the type of HRT I want. This is what I want, and this is the type of HRT I want. But not everybody's that lucky. But I definitely do the, come on, you can do it and you can get there. And I often say I've got friends that I would love to line up against a wall and just fire them all with an HRT. Why are you not trying it? Why are you not trying it? I think I saw a statistic this morning that there's only 12%, and I don't know when this was written, but it's from Louise Newson. There's only 12% of women that are actually on HRT. Now that might have gone up since Davina's done the programme, but there's only 12%. It's like, and I know I'm talking about HRT, and I feel bad for those that can't take the estrogen ones, but hopefully that, you know, there's other things out there. But yeah.
I think sometimes just like advocating for others. So we often, like I said a bit earlier, and we were talking about earlier, you know, as empathetic people working in this industry, we always would push other people to do what's right for them. And if we have knowledge to empower them, then that's really helpful.
Yeah, definitely.
But sometimes even just making the decision for ourselves, like to advocate for somebody, sometimes it's in actually doing the thing ourselves. So maybe we're dishing out advice that we're not taking. So there may be people who work in practice that have clients, and we're talking specifically about HRT. This could be any issue, you know, work-life balance. Are you getting the rest and recovery that you need, for example? And it affects everyone. And I've talked about this with my colleagues at work, you know, like in terms of like an academic cycle, you know, as a lecturer. And we get a really long summer break, which is great. But the nature of our, you know, maybe we have quite long kind of teaching semesters. And so our breaks for, you know, each weekend sometimes encroach. We get a little bit of work we have to do on the weekends, and our rest in the term time can be very hard to find. And we're teaching a subject, sports therapy, that is like the basics of recovery from injury or training is rest and recovery, isn't it? You know, like you need to rest between exercise rehab sessions to make sure that healing occurs. And those principles apply in sports therapy, they apply in, you know, a therapy practitioner's clinic. You know, between your sessions with clients, you need a turnaround time. You need, you know, you need to make sure that you're getting the food and water that you need to function. And if medication is needed to manage hormonal fluctuations or other symptoms of other conditions, that's true too, you know. And if we don't do that, we're not advocating for ourselves, and we're not setting examples for our clients to follow. I think, like, Lesley, it sounds like you're setting the example and like just flying the flag for HRT, and it's really good. It would be great to have done a study to see like the impact of Davina's you know, just to document that, because everybody's talking about it.
I think big, because and even I've had so the first one that I went on was a gel, and then after Davina's program came out and then the second program came out, we ran out of gel. Like, there was a stock.
Oh yeah, I did hear about that. Yeah.
Yes.
I went on the spray.
Yes.
So I just put in a prescription for the spray last week, and the pharmacist phoned me and went, we can't get the spray. So everybody's gone gel, right? No gel, no spray, no spray. So we're going to go back on the gel. So and I do think that's because a lot of people have watched the Davina program and gone, right,
fantastic.
This is for me. But it's like you say, a lot of the stuff is it doesn't necessarily have to be around HRT. It can be around how you're controlling, you know, good sleep hygiene, like Matt's been talking about, you know, all of that sort of stuff. Making sure you're getting your sleep, you know, making sure you're getting your rest, nutrition. Absolutely. I mean, self-care is up there, man.
Absolutely. And I think what you're saying to me is, Lesley, about the HRT, it's great if you can take it, and there's a wobble with it. You've got to balance it. Everybody's an individual. But then again, with non-HRT, again, you've got to wobble it. You've got to Shoogle it. You've got to make sure that your whole individuality of you and what happens with you. So HRT might not be for everybody, but there may be elements. So, for example, why can't you take HRT? What's the problem? So go to the Balance app. What are your symptoms? What is lacking? Get a blood test. Find out what's lacking in there. Have to take a lot of supplements to try and balance out some things, and for me, that's the route I have to go down. And I need, like you say, to make sure I'm sleeping correctly. I need to make sure I'm eating correctly. I need to make sure my blood sugar level is stable. I need to make, you know, so like you're saying, the work-life balance on HRT has made life so much easier, because it takes this element of me trying to balance. But once I've got everything in place, like the online system, the balance system, etc., I think, right, I'm going to have a rubbishy week. Make sure I've got plenty of protein on board, plenty of, you know, so I know how to manage it. You know, there's other conditions that women go through and men go through, and however you identify. For example, a very good friend and professional colleague of mine is bipolar, and she has to balance her medications and her supplements to make sure that she has a good work-life balance and she's stable, etc. So there's lots of other complications that come in, not just menopause, not just work life, whatever, but to try and get that work-life balance. There are outside influences that happen all over the place. And I think today's chat with you, Lesley, has been invaluable to some of our listeners. The stuff that you've touched on and how you're managing it is a real advocate alone on what you actually personally do for your clients. So I'm really grateful for the time that you've spent with us today, and what you've brought to the party is incredible.
Yeah.
I can't take compliments. Thanks.
Just thank you is good. Yeah, it's not a compliment I mean, yes, it's a compliment, but it's also it's recognizing what you brought to us today and what you do, and that's something that's just being recognized. And if you hadn't have spoken to us today, I know that you're not particularly comfortable doing this kind of stuff, so to broach over that is just incredible, and that's what I'm thanking you for. So it's not necessarily all a compliment, it's grateful. Yeah, so absolutely grateful for doing this today.
Yeah, and I think just from a perspective of somebody that's not I mean, we're all therapists, like, and it doesn't matter actually who you are. Work-life balance is something that everybody has to deal with who works, and you know, however you consider work, whether that's like financially benefiting, or whether you're a carer or a parent, you know, making sure that we get the balance is something that is very difficult to do, and also easy to deprioritize when other people are dependent on us. And there's just like a couple of things, like before we wrap up, that I think firstly, like Debs, you haven't asked the question that was the true or false statement.
You know why? I was resisting it. I'm so sorry. You're absolutely right. I haven't asked that question. And the reason I haven't asked that question is because I just keep wanting to burst into song when I keep reading it and thinking, I can't do that. I can't do that on it. So the question is, so I just want to sing it. I can't help myself. So the question is, Lesley, true or false? Women can have it all.
I can't answer that. You see, what is all? Now that I'm not a very deep person, but what is all? Like,
that is deep.
I've got a pants car, a small house, majorly happy life. Have I got it all? I think so. Yeah.
So it's personal. Can you have it all? It's personal to what you think all is.
Yeah. I was like, well, wait a minute. What's the all that I would want?
That is a great answer.
Yeah.
That is a great answer. What do you think, Fiona? Are you happy with that?
I'm really, that is a great response, and I think you're right that, you know, having it all means something different to every person. You know, and actually, like, I think that you could probably argue any case with this, because it's such a subjective kind of statement, isn't, like, responding to that would be so subjective anyway. I think it's more about like what can you deal with, like, to get the optimum out of your life, and in many areas, you know. So I think, like, a while ago, I remember sort of thinking about this and pondering, and, you know, I think I read it somewhere as well that, you know, there's perhaps like 3 or 4 major areas of like work or relationships and social in our lives, and like really trying to get more than one area of that like fired up at once is really, really difficult. If you have 2 areas ticked, great, like chances of getting everything like on form at once is just statistically like impossible almost. So making sure that we're looking after ourselves and making the most of opportunities without overly, like, what's the word, like, compromising our own well-being is probably the priority.
Yeah.
Don't ask us to fill in the blanks. We're perimenopausal.
Oh, sorry. Yeah. Oh, brilliant. Well, I think on that note, I mean, Debs, did you have anything you wanted to add? Like, what was your, like?
I want to sing.
You still want to sing your response, or?
I want it all. I want it all. There you go. Oh my God, I'm dying.
She really has it all. She can sing. She's a triple
I don't know about that.
Sings,
Just like a really quick share of what happened the other day in a car park, talking from a perimenopausal situation. So walked out of a supermarket, and it was very hot the day before. As we all know, we've been dealing with a heat wave. And I walk out, I've got 2 bags of shopping. There's a guy standing behind me, and he says to me, "Oh, it's not as hot as yesterday." I turned to him, and I was so rude. And I said, "I'm really perimenopausal right now. I think I'm dealing with PMS. Don't even speak to me." And he went, "Oh, sorry." I got in my car, put my aircon on, and went, "Oh, you're absolutely..." Leslie's killing herself laughing. If you can't see it, she's absolutely killing it. And I thought, oh my God. I went to see my reflexologist, and later that evening, and she pressed on the adrenal gland, and she said to me, "Oh yeah, you're really high there." And I went, "Yeah, no kidding. Let me tell you this story." Yeah. And that poor man, I just felt absolutely, yeah. So, yeah, perimenopausal situations happen.
Is that a public apology there, Debs?
I'm so sorry.
You're listening, the man who was... Oh, yeah, it is. It can catch you off guard. And if you're not familiar with that, like, I think hopefully maybe this is a point that we didn't really talk about, but like explaining that the areas of sensitivity and how easy it is to push those buttons, you may not even know that you have tripped the wire, like, and you get like
told him.
full on but it's not personal. Usually it's not personal. Clearly this one was not personal.
Convey that look, it's not your fault that I'm not speaking to you. I'm really not happy right now, and just don't talk to me.
Yeah, it's really not personal. Oh, lovely. Wow, brilliant closing story there, Deb.
Just thought I'd share that for anyone out there that's going, I have days like that too, but I never did what Debs did.
Yeah. Or maybe if you've done worse, you can email us at WIST.
Yeah, that'd be great.
We can talk about it next time.
How would you have handled that, Lesley?
Do you know, I've got a really good pal, right? And she was in an office. I've never worked in an office environment, and she was in her office, and somebody kept playing the music loud. I think this was the background. Somebody kept playing the music loud or putting the music on, and eventually she said, "Turn the music down. I'm a little bit stabby today."
Just a little bit.
So I would maybe just people, I'm a little bit stabby today.
Stabby. Right. It's a very like nearly aggressive, but not quite.
Is that one of the microaggressions?
That is probably, yeah. Like, I mean, that's another subject area in itself.
I don't know if that was microaggression.
That's definitely quite aggressive.
Right in there.
But yeah, I think that does, and it's quite easy to laugh now. But I think the thing is that when you're in that moment, like, it's not funny. Like, it is not funny, and it's so easy to get a rise out of somebody who is just teetering on the edge of like snapping. So anything could trigger it.
I think it was a good way for diffusing it as well, because I think it made, you know, she was able to talk about it in a way that kind of
humour.
Like she there was something happening in the workplace that she was like, this is kind of getting to me a little bit, you know. She was able to kind of like say it and
lighten it up a bit.
Yeah, absolutely.
I'm going to lose power. 2 seconds.
Ooh. Well,
so I think we're kind of doing sort of hashtag be kind, aren't we? Regardless of how we're feeling, just hashtag be kind. I think I've learned a lesson there. Definitely.
Yeah.
Hashtag, I'm a little bit stabby today. That may have got me in the police station. I probably shouldn't have said that. Probably not a good idea. So yes, we do have to wrap up, sadly, with Lesley today. I'd just like to say it's been an absolute pleasure speaking with you. And like I said before, I'm really grateful for everything that you shared. And I'm sure the listeners will take a lot of information. And I'm handing over to you, Fiona, to close down, please.
Yeah. So obviously, as we mentioned earlier, thank you, Lesley, for these like fantastic conversations and suggestions for the particular resources that you mentioned. So for the listeners, we will be putting the links in the show notes at the bottom. So if you want to follow anything up, please do take a look. And if you can't find what you're looking for, then please do reach out to us on social media. We're on Twitter and Instagram with the handles at UK_WIST, so WIST. You can find a lot of resources on the STA website, and we also have email addresses, or an email address, wist@thesta.co.uk, if you want to reach us with any queries. So I guess that's all that we have for this episode, but we'll be back very soon with the next series. This is the end of our 5 episodes series 1, so yay to us, and we'll be back in the autumn with a new series for you with some fantastic guests and subjects, so please stay tuned. If you like the episode and you want to leave us a review on Apple Podcasts or any other platform that you're using, please do, and also subscribe to keep tuned for the next series, and we'll see you on the next one.
Thank you. Bye-bye.